Hello everybody, I'm Dr. Rashida from Open University Malaysia. I'm very honoured to be able to speak to you today regarding from the nation perspectives on professionalism in nursing. Here you can see from the picture, my slides, this is the Malaysia and the map of Malaysia, and we also have, these are typical nurses in Malaysia. They are all in white, most of them, when they are working. These are my key points on my topic today on professionalism in nursing. I'm going to talk about definition of the nursing profession as a profession, and I'm going to talk about also what is you mean by professionalism and barriers to full profession. And also, I will give you a slight information on historical development of Malaysia nursing profession and the career pathway of our nursing education. So just listen to the topic today, and I will tell you that it's going to be interesting because maybe there is similarities between Sri Lankan nursing profession and our Malaysian counterparts. Okay, I'm sure you already have a topic on nursing professionalism, but here I will give you the definition from Cummings on what is the definition of profession. It is an occupation whose incumbents create and explicitly utilize systematically accumulated general knowledge in solution of problems posed by clients, either individual or groups. That is in 2019. So that is the definition of profession. We will look into what is a profession. Are nurses having a profession, or is just a daily work, a day-to-day job for if we feel that it is a profession? So let us think of what is a profession. A profession is a dynamic process whereby many occupations can be observed to change certain crucial characteristics. So what can we look in these crucial characteristics? This change begins with the individual. How does it change? That personal transformation that we talk about, nurses, you are experiencing, and involves to encompass most of the practice in a given occupation. Previously, nursing is an occupation, but now it has transformed into a profession. So what are the barriers to full profession? You must, if you listen to this topic while I'm talking, you will think that there are many barriers to fulfill this profession. Within the profession is the entry into practice. There are certain criteria that they need for you to adhere to if you need to enter nursing. Of course, there is the body of knowledge and the application of this knowledge in practice within the profession. And outside the profession, what is the barriers? It is the legal status of nurses functioning in the expanded role and the lack of autonomy, which is something that from yesteryears until now, we are still talking about lack of autonomy and entry into the practice. How do we want the entrance qualification to be? Should be at a degree level? Should be it at a O level? It is still being discussed. So how do we overcome the barriers? So in nursing today, contemporary nursing, we try to have research in our curriculum because we need to develop and expand the body of knowledge, nursing knowledge, and apply knowledge into practice. And also our education system has to be transformed. Bachelor of Nursing and Bachelor of Science as the entry level into professional nursing practice, and support for advanced education in nursing. There is also the legislation, which is held by the professional body that we have to follow, like protect against threats to our privilege to practice, and distribution of the workforce. Continue to expand into the community to make nursing more visible. And of course, there is another point that contemporary nursing is talking about is entrepreneurship, especially in Malaysia. The topic of entrepreneurship, maybe in Sri Lanka, it is not important, but our governing body feels that entrepreneurship should be taught to the nurses. How is it important? Because nurses are expanding. They will go into private practice or they will work on their own. So they need this body of knowledge, being an entrepreneur, to be a success in their career-wise. The compasses that direct our profession in Malaysia. We have the Code of Ethics for nurses and nursing social policy statement, which we have, all nurses in Malaysia have to follow. And we also have to follow the standards of professional practice and performance. These are two important things that we steadfastly held by the nurses in Malaysia. Nursing as a profession. We talk about it, and maybe there are similarities in Sri Lanka, but these are the things that I can relate to in Malaysia. Nursing is a profession within the healthcare sector and focus on the care of individuals, families, and communities so they may attain, maintain, or recover optimal health and quality of life. That is the vision and mission that is important to nurses. Nurses may be differentiated from other healthcare providers by their approach to patient care, training, and scope of practice. Nurses practice in many specialties with differing levels of prescription authority. That means we have medical, surgical, orthopedic, renal, we have operation theatre nurses, and also advanced level diploma. All these programs, we call that advanced diploma in nursing. Okay, specialty for the specialty. Many nurses provide care within the ordering scope of physician, and this traditional role has shaped the public image of nurses as care providers. But up until now, nurses has a little bit more autonomy in Malaysia because we are not anymore handmaiden to doctors. Professional nursing practice. Let me just describe a bit about our professional nursing practice. It is a nursing social policy statement, and it has a definition of nursing stating that nursing is defined as the diagnosis and treatment of human responses to actual or potential health problems. So, attention to the full range of human responses and illness without restriction. And we have to integrate objective data with understanding of subjective experience of the patient. Application of scientific knowledge in the process of diagnosis and treatment. And we also have provision of caring relationship that facilitates health and healing. That is our professional nursing practice. Our professional values we hold to is the Code of Ethics. We have 7 primary values. That is, we provide safe, compassionate, competent, and ethical care. And we promote health and well-being. We also promote and respect informed decision-making and preserve the dignity of the patient and try to maintain privacy and confidentiality of our patients. And we also promote justice and being accountable for our nursing practice. Principles of professionalism that we teach our students is about altruistic concern for patient welfare. Individuals bound together by commitment and in a specialized body of knowledge, and self-regulation, accountability, integrity, and honesty. Social contract with society, service to the public, ethics, ethical behavior, and patient autonomy, dignity are cared for. And of course, social justice, that every patient is equal regardless of poor or rich. Professionalism in nursing. Our knowledge, spirit of inquiry, these are the things that the criteria that is needed in professionalism in nursing. We must have nurses must have accountability, autonomy, advocacy, innovation and visionary, collegiality and collaboration, ethics and values. These are the things that we taught our students regarding how to become a professional nurse. And it should be included, and they should be practicing it in everyday life. Okay, let me talk about where I have told you the characteristics of how nurses should be, what are the things that they need to be accountable to. And now let us look at Malaysian nursing, development of Malaysian nursing. We started in 1800. Nursing career began in Malaysia. At that time, it was called Malaya. And the first services started in the state of Penang. Penang is somewhere here, it's an island, and Singapore is also an island. During that time in Malaya, Penang and Singapore is ruled by the British. And members of the East India Company, which were later replaced by the Catholic nun. So this is where it started, Penang, an island, and just like Sri Lanka, but much smaller, and Singapore. In 1988, the first on-the-job training for nurses was held in Johor Bahru. Here is Johor Bahru, the tip of the southernmost state in Malaysia. I wonder if any one of you has visited these states before. It is just across the causeway to Singapore. And it's in that year, in 1942 to 1945, to 1945, during the World War II. So this is the first on the job training for our nurses. And then they started the School of Nursing, and that school was in Hospital Johor Bahru. This is Johor Bahru. In 1946, our School of Nursing hospital was also held in Penang, which we call Pulau Penang Island, in 1947, and also in Hospital Kuala Lumpur, where is our capital now. The capital now is Putrajaya. Previously, it was in Kuala Lumpur. Kuala Lumpur is somewhere here in Selangor, in the state of Selangor. So in let me see, I can't even see what is this. 1923, they have the legislation for the practice of nursing, and also in 1950, Nurses Act was enacted, which provided for the establishment of the nursing board. So that was the time we formed our nursing board. In 1966, Midwives Act and the development of the midwifery board was also regulated, the practice of midwifery, regarding the registration of all nurses. Midwives were established during this time. That was in 1966. So this is the state of, this is Malaysia. It encompasses of Sabah and Sarawak in the east, and East Malaysia, and West Malaysia belongs to the 13 states. Okay. So our nurses training in Malaysia. In 1967, we have the first private school of nursing, which was called Tuan Tan Cheng Lock School of Nursing, which is in Petaling Jaya. And then we have in 1968, University Hospital School of Nursing Kuala Lumpur was set up. Both schools were subjected to the 1950 Nurses Act regulations and procedures. So this is the first time that nurses were trained proper with all the Nursing Act regulation and procedure. Up until 1992, the graduates of a nursing program on passing the final nursing board examination. So they have to pass the final nursing board examination, which was formed by our nursing body. So where are we now, Malaysia, in the education for nursing? In 1993, we started the tertiary education for nursing, and the first university program started in 1993 in the University of Malaya, which we have admitted diploma graduates to prepare them to become nurse educators and nurse administrators. It was a 3-year program awarding a Bachelor of Nursing Science with honours. So in 2003, the Quality Assurance Division, which is now in Malaysia, is a very important body for any education program, is the Malaysian Quality Agency and also the Higher Education Ministry through a high-level committee, including a member of the Nursing Board of Malaysia, developed guidelines in curriculum design for a 4-year Bachelor of Nursing honours. So now we have our program in Malaysia. All nursing program must have a 4-year Bachelor of Nursing with honours. So let me show you. This is our career pathway in nursing in Malaysia. We have the important is first they must have at least an A-level, or we call it in Form 6 above students, and then they will do their diploma in nursing. They join as a diploma program, and then later on, when they qualify after 3 years, they become a registered nurse. The nursing board will give them the registration. After that, they will do, if they prefer, they can do their degree in nursing and become a clinical specialization. From there, they can have clinical specialization in whatever program, like previously I stated that they can do renal, they can do ICU, intensive care nursing, and they also can have a degree in nursing, clinical specialization. They can do degree in nursing, where they can become a charge nurse, a clinical instructor, a ward manager, or a nurse lecturer. So the academia world of nursing profession has evolved into several stages of qualification offerings, such as diploma, advanced diploma, bachelor, master, and doctor of philosophy, to fulfill the requirement stipulated by the Ministry of Health, Malaysian Qualification Agency, and the Ministry of Higher Education. So we have a full-fledged now from diploma to PhD level. This is in line becoming of a developed nation, where we will need to produce more postgraduate holder and research study in the critical area, which includes nursing, and therefore nurses' role are now expanded, not only limited to clinical setting, but require various expertise in academic research and top division management of the nursing profession. So but there is also a catch here. Although nurses in Malaysia has put their initiative to pursue their training and for professional development due to their personal interests, but the career pathway is still not clear to date, because we need to bridge the gap between academic and clinical. So there are many issues, although we are going through several hiccups along the way, but we need to persevere on to improve the nursing profession in Malaysia. So thus there is a need. Of course, we need to recruit. Then they decided that they need to recruit more male nurses, creating a clinical nurse specialist and to avoid brain drain, because some nurses they feel that very suffocated when they work in Malaysia and their pay are not enough, and they feel that if they go overseas, like countries in that can offer them more, in their way of living. So there is a brain drain of the geniuses, and to reduce burnout issues among Malaysian nurses, because those who are left behind, they who struggle and persevere will have a time and where they get burned out, or else they can become demotivated among Malaysian nurses, and this was since set in the effort is not appropriately, because they are not appropriately valued by the management of the healthcare system itself. So since nurses are the heart of the healthcare team with multitasking role, there is also a need to look upon their welfare by various responsible organizations in the future, because we do not want to lose many good nurses to other countries. So you can see here from the picture the burnout and how they become demotivated. These are some of the problems that we are facing now, and we will try to improve the situation, but it is not everything is rosy, but we need to improve our nursing in the future to make to enable them to give Malaysian the best healthcare in the world. So more support and supervision from the universities or college management is needed, especially to motivate our nurses with masters and doctor of philosophy, to get them involved in research and publication, since the acceptance is still low or moderate in certain level of the institutions. So I end here by saying that you students out there is never too late to learn, because learning never ends, and keep educating yourself, because that is the key to our success in the nursing profession. So I end this with the references for this topic of nursing profession in Malaysia. I hope you enjoyed the talk that I gave you, so you might as well take care of yourself and be inspired, be able to do well in your studies. Thank you.